Hi, dear students. Uh, Today we will see the classification of the antihistaminic agents, and before already we've seen the what is the meaning of antihistamine, then what are the receptors are there. Okay, detailed study we already seen that in previous our video. So today we will discuss about the class. What is the exactly the classification of antihistaminic agents? Okay, simple classification is there. There are two H1 antagonist is there and H2 antagonist is there. Okay, H1 antagonist and H2 antagonist. See, from H1 antagonist, there are three types of the subclasses are there. In that, first generations. Okay, first generation means it is the oldest H1 antagonist category, oldest H1 antagonist category, and it will inexpensive drug category also. Okay, inexpensive. There are some examples are there: diphenhydramine maleate, then diamine hydramine, then doxylamine succinate, then triethylamine HCl, promethazine. Okay, these are the four different. Again, so many examples are there. So for understanding purpose, we will see the examples in that first generation, and it will relieve the allergic reactions. Okay, so we can say that this is the first generation category under the H1 antagonist. Okay, next is the second generation. It is a less sleepiness category drug. Okay, generally we example is that the cetirizine, or cetirizine is a common example for the second generation drugs, that is cetirizine and loratadine. Okay, these are the two types of categories involved and examples involved in the second generation. Okay, next last is the master cell stabilizer. It also one type of the H1 antagonist category. Example is chromolyl sodium. Okay, so this is the H1 antagonist. In that, first category is first generation, second generation, and last is the mast cell stabilizer. Okay, so next we will go towards the H2 antagonist. H2 antagonist is widely used for the treatment of the duodenal ulcer as well as the gastric ulcer or peptic ulcers. Okay, so these category drugs we can use for that purpose itself. So H2 antagonist, in that there are two subcategories are there: gastric acid inhibitors. Okay, so what are the acid inhibitors? See, the example is cimetidine, famotidine, ranitidine. So see the example for understanding purpose, the tidine, right? Ranitidine, then cimetidine, then famotidine, etc. So this is the category of the gastric acid inhibitor. After that, we will go towards the gastric proton pump inhibitors. We can say that PPI. Okay, gastric proton pump inhibitors. So in that, it is a simple way. In that, we can say that the examples of omeprazole, then lansoprazole, then rabeprazole. These are the examples included for this category, that is the gastric proton pump inhibitor. This is the simple classification of antihistaminic agents. You can say that there are simple way to understand that only the H1 antagonist is there and the H2 antagonist is there. Then further classifications are there. First, under the H1, it's a first generation, second generation, and mast cell stabilizer. Under the H2 antagonist, it is gastric acid inhibitors and gastric proton pump inhibitors. So this is the classifications. Okay, so guys, you study well for this classification. For this is important point of exam also. So classifications they can ask about this. Okay, so this is the today is a part 3 exercise. For next video we will see the exactly SAR. Okay, structural activity relationship of the so many drugs are there. So we will see that common structural activity relationship. Okay, so those who are not followed by subscribe this channel, please subscribe this channel, so for next notification of videos. Thank you so much.